An interesting history of blood transfusion. Dear friends, welcome to our YouTube channel Knowledge Basics. This video will prove to be very important for you. Please watch this video from beginning to end. Today I am going to tell an interesting history of blood transfusion. This information will prove to be very important for all of you. Through this information, you'll get complete information about blood transfusion, which means blood in the body, which will develop in your education and intellect. In today's time, new records are becoming increasingly in the medical field. It was not a new thing to bring any person out of the mouth of death today, but it was a very difficult task to do all this in the past. Some diseases used to be like this, that the treatment was far away. It was also very difficult to stop them. In modern times it is quite common to save one's life from one person's body to another by giving blood. But do you know when and how did it start? Let's try to find an answer to this question. The first blood transfusion was first performed by the animal. It is believed that blood transfusion was first introduced in the 16th century. In 1628, William Harvey described blood transfusion for the first time. Then around 1659, Christopher Wren invented syringe for the first time for blood transfusion. Using it, doctors practiced blood transfusion for the first time on animals in England and France. In 1666, British Dr. Richard Lower registered his name in human history when he transfusions the first successful blood between two animals. Since then, the journey of blood transfusion began and the scientists began to speed it up. After this, the first was in 1667 experiment on humans. After the animals, the time had come that it should also be used for human blood transfusion. Blood transfusion was first introduced to humans from 1667. The credit for blood transfusion is first of all on humans, which goes to Jean-Baptiste Denis, who was the physician of King Louis XIV of France. Jean had two cases of two patients. One was a 15-year-old child and the other was a laborer. Both needed blood only. This work was difficult, but Jean decided to do it. Jean took the blood of one sheep and put it in both patients, and it was successful. In this way, Jean opened the first human blood transfusion and opened the new doors of human medicine. And this became a history, and it was very interesting because the blood of an animal was first put into a human being, which was also successful. Seeing the success of Jean, the rest of the doctors were also using sheep's blood. It was certainly successful in some cases, but it was not always necessary to be successful every time. Sheep blood is different from human blood, so there were also some side effects of using it in transfusion. In the beginning, everyone was unaware of it, but after some time it was banned. The blood transfusion process is still not stopped even after the blood of a sheep is banned. People started using different types of things. Finally, in 1818, British obstetrician James Blundell offered the blood of a person for the first time in another patient. This method proved to be quite effective, but it got real recognition when in 1901 by Austrian physician Karl Landsteiner when he discovered the human blood group. After this, it could be determined that blood transfusion can be a safe operation. He told how many blood groups are there in humans and which blood group they match. His step changed the world. How many lives were saved due to this, and the cycle continues unabated. First, blood collection. Blood storage has had a great effect on humans. Because of this, blood is available to save a needy person at all times. It is said that it was started in 1921 due to the members of the British Red Cross. He donated blood to the King's College Hospital in London for the first time. From here, blood began to store so that it could be used at the time of need. The world's first blood bank was also opened in 1936. It was opened in Chicago's Cook County Hospital. It is said that the real value of the blood stores was revealed during World War II. A large number of soldiers and civilians were injured, which led to a huge demand for blood. America's Red Cross Blood Services started its journey in the meantime. He launched a blood donation program on National 7th and collected large amounts of blood. That blood was sent to the military zones so that the lives of the soldiers could be saved. Blood collection was started in this way, which is used to date. Next to the importance of blood transfusion. Today, blood transfusion is a very important thing. According to statistics, at least 5 million people in the US need a blood transfusion every year. This is a very large amount. It is not that blood transfusion is used only during big accidents, but nowadays it is also used in small things. For example, if you have any surgery, you may need a blood transfusion. This is because most of the time the patient loses blood in some quantity and sometimes too many times during operation. Many times the patient also needs blood because of an accident. On some occasions, due to illness, we also need a blood transfusion. There are some diseases of liver and kidneys in which the body is unable to make blood all the way. In such a situation, they also have to undergo a blood transfusion. At the same time, there is a great need for blood transfusion even in India. India has such a high population that there is a lot of demand for blood. After many attempts, blood pressure is found here in the blood bank. According to information in many states, there is a shortage of blood in the blood bank of many states, so it is more than enough in many. Due to all this, 10% of total blood loss is found throughout the country. It is believed that there is a change in it, and now the situation is good compared to the previous one. The government of India is now more active towards it. Blood banks are being opened everywhere in the country so that anyone can easily donate blood. It is expected that in the coming time, this shortage in India will be fulfilled. Now let's see what happens before and after blood transfusion. Blood transfusion is a simple process, but before that many things are done too so that it can be successful. Before transfusion, your blood pressure, pulse, and temperature will be measured. Your blood will be examined and it will be known what blood group it meets. When all the tests are completed, you are sent for blood transfusion. Transfusion can last from 1 to 3 hours and it can continue even longer if needed. On rare occasions, this happens that someone has a problem with the transfusion process. If you start bleeding, pain, back pain, headache, vomiting or heartbeat during transfusion, tell the doctor immediately. After the transfusion process ends, your body takes a little time to adjust to the new blood. If you have any problems during this time, please inform the doctor immediately. After the transfusion, you have to rest for 24 to 48 hours, and after that time you have to go to the doctor twice. In this way, blood transfusion is completed. Now let us know the answers to some urgent questions and the necessary information related to it. First, what is blood plating? Second, the process of blood transfusion. Third, benefits of blood donation. Fourth, loss of blood. Blood transfusion is called blood transfusion in Hindi. Commonly speaking, it is called the blood donation. Blood transfusion or blood transfusion is the process of transferring red blood cells, platelets, and plasma to someone's body. Trauma, bleeding disorder or operation due to excessive bleeding, etc. requires a blood transfusion. The need for bloodletting also occurs when the body itself is not able to make enough blood or other components of blood as per the requirement for some reason. Blood donors are usually collected from voluntary blood donors for blood donation. Blood-donated blood is thoroughly investigated so that blood of any kind cannot be transmitted. This article has been explained in detail what is blood donation, what is the process of blood transfusion, and what can be the advantages and disadvantages of blood transfusion. It has also been mentioned that who needs a blood transfusion. First question: what is blood plating? Blood transfusion is a medical procedure in which donated blood is transplanted from a thin tube into the vein of your hand. Anyone's life can be saved through this process. If someone is bleeding due to injury or an operation, then blood can be saved by this procedure. Blood transfusion is usually done without any complications. If there is ever a complexity, then it is very rare. People need blood for several reasons, such as injury, during operation, bleeding disorders, etc. There are some components of blood that are as follows. Red blood cells carry oxygen in the body and remove waste from the body. White blood cells help fight infection. Plasma is a liquid part of the blood. Platelets help to have the right blood clot. Transfusion or blood transfusion provides the body your body needs. Red blood cells are the most climbing component. This type of blood can also be offered to you all the components together, but such is done less. Researchers are trying to make artificial blood, but till now no proper alternative to human blood has been found. When anyone is given blood, it is seen in which type of blood is its type, such as AB or O. If someone is given wrong blood, then the antibodies of the body attack it as an intervention, which can cause problems. Approximately 40% of the blood of people belongs to the O group, which can be donated to most people. If your group is O, then people in your group are called universal donor. If your blood group is AB, then you can be given blood of any group. That's why people in your group are called universal recipe. If your Rh value is negative, then you can take Rh negative blood only. Second question: the process of blood transfusion. Before starting the process of blood transfusion or transfusion process, you were understood the whole process and you were signed a consent letter. Blood samples are taken to check your blood group. You are only given the blood that is safe for any person in your blood group. During blood transfusion, you are sleeping on the bed or sitting on the chair. A needle is thrown in your arm or hand. This needle is connected to a blood bag tube. The blood through the tube goes into your nerves. It can take about 4 hours to give a blood bag. If you do not suffer from serious illness or you do not need too much blood, then you can go home comfortably after the procedure is complete. Third question: the benefits of blood donation. With the help of blood, thousands of patients are saved every day throughout the world. Due to the release of blood from the nerves, blood flowing can be filled with blood. By red blood cells, oxygen reduction in the blood can be met. The need for platelets can be met by patients who have chemotherapy, or bleeding can be done due to the operation. By maintaining the ability to clot blood plasma. Hemophiliacs, a disease that does not accumulate blood clots, helps in living a normal life and contains immunoglobulin, a type of protein found in the cells of the immune system, which is the antibody works, which provides passive immune resistance to the person at risk of certain infection. Blood transfusion has become a useful part of modern medicine, but the blood should be donated only when it is needed. Fourth, the loss of bleeding. Blood transfusion is considered to be a safe procedure, but still, some patients may be uncomfortable with it. Following are some side effects of bleeding: headache, fever, itching, respiratory distress, pain in chest, sudden reduction in blood pressure. These mild side effects do not affect all patients, and these effects can also occur even if you have been given the right blood. If a wrong type of blood is given, then it can be very dangerous. However, this possibility is unlikely because blood tests are done before blood transfusion. Note: this article is for informational purposes only. Our channel, Gyan Baaten, is not advised of any kind of medical treatment at any cost. Decide only by talking to your doctor about what medical treatment is right for you. Blood transfusion is one of those searches that completely changed the lives of humans. If this were not there, we have to face many problems today. Well, what is your opinion about blood transfusion? Let us know in the comment section.